When you hear the word malnutrition, what's the first thing that pops into your head? For most of us, it's probably a picture of someone who's severely underweight. But what if I told you that's just the cover story? The real condition, well, it's often hidden, like a medical mystery that needs a detective's eye to solve. So let's grab our magnifying glass and dive right in. All right, first things first, we've got to bust the biggest myth right out of the gate. Malnutrition is not just about weight loss or some number on a scale. The reality, as experts now know, is that it's a super complex medical condition. And its main partner in crime? Inflammation. This one idea completely changes the game for how we find it and how we fight it.
So, if it's not just about the food we're eating, or not eating, then what is the real culprit here? Well, as we're about to see, the answer is inflammation. It's the key that unlocks this whole medical mystery and totally redefines how we think about malnutrition in a hospital or clinic. Think of inflammation as the perfect disguise, right? When your body gets stressed out from an illness or an injury, its internal chemistry just goes haywire. It shifts into defense mode and it starts prioritizing certain proteins to fight that stress. In the process, it lowers the levels of other key proteins like albumin. For years, doctors used albumin levels to spot malnutrition. But now we know that inflammation makes that test completely unreliable. It's a total red herring. This brings us to the three different crime scenes, if you will, where malnutrition pops up. First, you've got your acute illness or injury. That triggers some severe inflammation. Second, there's chronic illness, where you've got this mild to moderate inflammation just kind of simmering in the background for a long time. And then there's the third one, social or environmental situations, like starvation. And get this, that's actually the one case that happens without any inflammation. So each of these scenes needs a totally different investigative approach.
So how do our dietitian detectives actually crack the case? Well, they're not just relying on a single clue or a gut feeling. Nope. They use an official, internationally recognized checklist to look for a very specific pattern of telltale signs. It's all about cracking the code.
And here they are, the 6 core clues on their list. You've got the stuff you'd expect, right? Like not eating enough and losing weight without trying. But then you have these more subtle signs, like losing muscle and fat, fluid building up in the body, and even a drop in physical function, like finding it harder to just stand up or walk across a room.
And here's the kicker. This is the really crucial part. A patient doesn't need all 6 of these signs, not even close. A diagnosis can be made with just 2 of these characteristics, just 2. That's why having a trained eye is so important. It's about spotting a pattern, not just one obvious clue.
Okay, so we've got the checklist. Now we move from the paperwork to the actual physical investigation. This is where the dietitian basically puts on their gloves and starts examining the body, looking for the biggest, most obvious clues it's giving off. So the first major clue is the loss of that subcutaneous fat, the fat right under our skin. And this isn't just about looking a little thinner. A real detective looks for very specific signs, like a hollow or sunken look around the eyes, maybe some dark circles, and cheekbones that suddenly look way more prominent because those natural little fat pads underneath them are gone. Next up is muscle loss, or what doctors call wasting. A well-nourished person usually has nice, rounded shoulders. But when that muscle is lost, the shoulder can get this squared-off look. The collarbone becomes super visible, and you might see a little hollow spot between the neck and the shoulder. It's a really distinct visual cue once you know what to look for. And here's where it gets really tricky. Sometimes the body starts holding onto fluid, which can cause swelling, usually in the legs and feet. Now, this extra fluid can actually mask the fat and muscle loss we were just talking about, making a person seem heavier than they really are. It's a classic misdirection that a good detective knows to watch out for. And as Dr. Laura Frank, an expert in this field, puts it so well, the dietitian is the right expert for this job. All of this detective work, all this searching for clues, it all comes down to one simple goal: improving the health and outcomes for the patient. But the investigation doesn't stop there. Oh no. Beyond the big, obvious signs, there's this whole other layer of evidence, the microsigns. And this is where the work gets really fascinating, uncovering these little hidden clues that almost everyone else would miss. This is really the advanced level work of the dietitian detective. It takes some seriously specialized knowledge to connect these seemingly small, totally unrelated physical signs to specific micronutrient deficiencies. For example, get this. Take a look at someone's fingernails. If they look kind of concave, almost like a little spoon, that is not just some weird coincidence. That is a classic physical sign that can point directly to an iron deficiency. It's a tiny clue that reveals a huge problem. The detective also knows to look inside the mouth. A tongue that's unusually smooth and has a strange magenta or deep, beefy red color. Yeah, that's not normal. This can be a major sign of a B vitamin deficiency, especially when called riboflavin. The body is literally signaling for help. Or how about bleeding gums? Or these tiny little pinpoint bruises under the skin called petechiae. You might brush those off as nothing, but these are actually hemorrhagic signs, meaning they're related to bleeding, and they can be a critical piece of evidence pointing right to a vitamin C deficiency. See? Every single clue is a piece of the puzzle. So after all this investigation, after finding all these clues, what's the end game? Why is it so incredibly critical to gather all this evidence and solve the case of malnutrition? Well, the impact is absolutely massive. An accurate diagnosis leads directly to better treatment, which means improved patient outcomes. We're talking shorter hospital stays, fewer infections, and just faster recovery times overall. And hey, when patients get better faster, that reduces complications and readmissions, which then lowers the cost of healthcare for everyone. It is a win-win-win. So the bottom line is this: correctly identifying all the different forms of malnutrition, both the obvious ones and the hidden ones, is the essential first step. It's not just about putting a name to the problem. It's about unlocking the door to effective, targeted treatment that can stop a whole cascade of more serious health issues from ever happening. Which kind of leaves us with one final thought, doesn't it? We are so used to measuring our health with numbers, our weight, our calories, our lab values, but this whole investigation into malnutrition shows us that our bodies are communicating in a much richer, more visual language. The real question is, are we learning to listen?